COVID-19 has put even the best healthcare systems in the world under pressure. But after 9 years of war, there's not much medical care left in northwestern Syria. And Dr. Muhammad Ismail warns a coronavirus outbreak there would be devastating.
If corona spreads here, it will be a major humanitarian and medical catastrophe by all measures. Frankly, our current preventative measures are not enough, and there aren't enough medical workers or hospital beds in Idlib to treat the large number of people here. There are more than 4 million people in a small area, many living in densely populated camps with little or no income. And there is lack of awareness among the people. All of these factors indicate the situation will be very bad if coronavirus spreads here.
Violet, a local NGO, is taking emergency measures to prevent the spread of the virus. It's trained 25 volunteers as part of a rapid response disinfection team. They're equipped with basic protective clothing and sprayers.
Currently, we are disinfecting shelters for the displaced, public spaces, and areas where people gather in Idlib. We have also built some isolation tents for people who contract the virus. So far, we haven't had any confirmed cases of coronavirus here, and hopefully, there won't be any at all.
Idlib province is home to people who are some of the most vulnerable in the world as the coronavirus spreads. They include Omar and her 9 children. They were recently displaced in an offensive by the regime to retake the province.
We barely escaped from the bombs and shelling. Their father was with us. The mortars and rockets were exploding right in front of the room we were in. Their father stayed inside, but we left. We don't know what happened to him.
She and her children are struggling to deal with their new living conditions.
The tent we're in now is very bad. These are rocks underneath us. The plastic is leaking water both above and below us. I try to dry the blankets, but it's impossible. There are no toilets or running water. There are no hospitals or even an emergency clinic to take the children to if they get sick. By the time we can get them to a hospital in a nearby town, the child could die.
Displaced Syrians are now also concerned that the coronavirus could make them all sick.
Of course, we are all afraid of this disease. It's not just us. The whole world is afraid of corona. If one child gets sick, then everyone is going to get sick.
For millions of people like Omar and her children, the efforts of volunteers and medical workers are critical for surviving not just war, but a global pandemic as well. Obaidahito, TRT World.